Having the college here that I could go to was important for me. I'm a wife, a mother. I worked the whole time I was in school. So the smaller town atmosphere is all I've ever known. So going into a big city with a big college where I know nobody or nothing it never crossed my mind. The instructors that I had, they were great. I did have to take like an English class and a math class, but I spent most of my time back in the health field. Marcy Cooper and Minnie McDonald were my instructors, so I spent a lot of time with them. They were phenomenal. Always there to help us, would stay after if they needed to, would call us if we had something that we were missing, or we could call them if we just needed something. They were always just there for us. They wanted to see us succeed. I am a mother and a wife when I started school back in 2014. My third child was actually 4 weeks old when I started. And I remember reaching out to Marcy, and I apologized because I missed the first day of school. I said, "I'm so sorry, my baby is 4 weeks old." She's like, "That is perfectly fine." She's a mother also. So knowing that she's a mother, and obviously she was not going to give me any bad grades for that first day, very understanding. And the thing that I liked the most about it was I could have all my classes on 1 or 2 days a week, which allowed me to still go to work and provide for my family, but get my education as well. Having the smaller groups, I feel, is a lot better for learning because it's a smaller atmosphere, so you have more of that attention that you can ask for. Or the small groups, if there's only a couple of us, it was easier to talk to each other, especially going into the class, not knowing anybody and making those friends. The smaller class size and the small groups just made you feel more comfortable. The main thing I learned, other than my degree, was just building the relationships with not only the instructors, but the other college students. Because we spent a lot of time together, working, studying, bouncing ideas off of each other, questions. So just building the relationships that you didn't expect to build. It's not like a big school to where they don't know you, they don't know your name, you're just another student. You build those relationships. We did have an externship that we did 160 hours, and the nice thing about that is we do it here at Mercy. The advantage that we have to do the 160 hours here is a lot of times you can walk into a job after. I've even hired a couple of the UNOH students. The externship, I feel, is a very vital part because when you're sitting in there, doing paperwork, it's different. When you actually come in to work, you're hands-on, and here we let them do everything that we do. Within their limits. So if they bring patients back, they clean the rooms. So having that hands-on really makes you think, okay, is this what I want to do for the rest of my life? Or, I think I'm going to back out of this. A normal day here for me can vary from day to day. Between meetings, outside of the office, inside of the office, making out schedules. A lot of times if we're short-staffed, I'll actually get out and help room patients, or check in patients, or check out patients. It's not the same thing every single day. I can have my calendar and I can pull it up and I'm like, okay, I have 5 meetings today. But I might walk in here and I may be 2 staff members short. So those meetings kind of take the back end of it, and the patients are what we do first. There's always a bright future in the medical field. The opportunities that you have are unlimited. My background is medical assistant. When I started here, I was medical assistant, moved up to a clinical coordinator, and then into the management position. So there's just so many opportunities. The advice that I would give someone looking into the medical field is absolutely go for it. Like I said, there's unlimited opportunities. If you want to start as patient care and move up, you can. If you're just happy with patient care, you can do that also. The medical field is something that I've always wanted to do, ever since I was a little girl. I swore I was going to be a nurse. Took a few different paths, but ended up still in the medical field. I'm not sure that I could ever see myself doing anything else. I don't know anything outside the medical field. So certainly, if they were looking at it, I'd say go for it.